this is Jessica DaMassa with WTF Health, and I am here with Zsuzsanna Varga. She is leading up the global partnerships for G4A for Bayer. Welcome, Zsuzsanna. It's nice to see you.
Nice to see you again, too, Jess. Thanks so much for having me.
Thank you. So I wanted to talk to you broadly about innovation. I mean, you're somebody who is going basically around the world talking to different startup companies in the healthcare space, and I'm ready to pick your brain. So, all right. So first off, I feel like Bayer has a really unique approach to how they're working with innovative companies. And so I want you to talk a little bit about these challenges you guys stage, whether it's in your accelerator program or your deal maker or your generator. You've got some very specific challenge criteria. Why is that? How does that help with the innovation and the ideas that you're getting in from the startups?
Yeah. So really, our approach is really two ways. So on the one hand, especially with the accelerator program, we're really looking for sort of the cutting edge stuff that's out there in the innovation space, specifically in digital health. So we really want to look for, what's happening tomorrow, not what's happening today, and how Bayer can play a role in that in helping sort of the technologies of tomorrow to help scale or sort of to guide through the regulatory pathways, for example. So that's one. And our second path is really kind of more focused on today, sort of what challenges does Bayer have in, sort of clinical trials, for example, by identifying the right patients for very specific diseases, and partner with external innovators that, have amazing access to data or data analytics capabilities. And on the other hand, Bayer sort of providing, their scale, their global reach, in that way. So so in short, we have two ways, sort of looking at today, but then also tomorrow.
So what's your best advice for a startup company, in terms of, you've met a lot of them, you're working with them, and whether or not they work with Bayer? I mean, what's some good advice that you'd like to pass out to all those health innovators out there?
Sure. I mean, looking through, by now we had over close to 5,000 applications and hearing pitches and stuff. Really one core essence that I see in startups that succeed is really having this very clear goal in mind that's, again, not focusing on today, but really having a broader vision for their company. So sort of not, well, I'm going to help you, analyze these data, but really sort of coming with a bigger vision. So I think, with that in mind, you target your whole team, your whole purpose, and your whole work around that, and that I find extremely powerful, motivating for the team, but also as a collaboration partner to see that focus, but also that vision, across, the years. So that's, I think, #1 success factor.
That's really cool. And I think a lot of founders, sometimes they're worried, okay, is my vision too big? And as a company like Bayer, are you afraid of that? Or are you like, hey, it's all right, you may not have all the answers, but we're excited that you see the potential beyond and we'll figure it out along the way with you. What do you think?
I can just say, the bigger the better. Also for Bayer, the mission is science for a better life. What bigger vision can there be, to really impact life? And other companies that, have a bigger scale vision like that, I think is extremely powerful. I think it's tricky when, you have a vision that, has numbers in it that you can't back, so it does need to be sort of realistic and I think just authentic, at the end of the day. So, yeah.
Okay, so I'm curious too. So here we are, we're at Health 2.0 in HIMSS Europe. Yeah. And we were just in New York a few minutes ago, it felt like. Like 48 hours ago. And so but what I want to ask you is, as somebody who goes around the world and meets with different startup companies and investigates the climate of innovation in healthcare in the US, in Europe, in Asia, all over the place, what are some of the key differences that you see? What's the difference between the innovation climate in the US versus the innovation climate here in Europe?
This is a really interesting question. I think a lot of people underestimate soft factors like culture, language, but then also, in my personal opinion, I think that each country or region has sort of its innovation footprint.
Like what?
For example, Poland is very, very top in IT topics, Then in Russia, a lot of engineering, more really heavy tech. And that has a lot to do with sort of the education system. That's where everything starts, right? How do we become who we are? It's really sort of the education and experiences that we go through. And growing up in a certain country, I think you're just exposed to certain topics more than others. So that's my hypothesis and just my personal opinion that I think you can sort of map this, looking at countries, like what are sort of the top talents, and that's also what you see in the tech very much reflected. And I don't know, I find that super interesting. So if anyone wants to work on this, please contact me.
I'm in too.
I think that's a super exciting area. And
the WTF Health heat map.
Yeah,
by G4A. I love it. Perfect. All right, so here's another question for you too. I mean, we hear a lot, so we go to a lot of these conferences, and you hear a lot of companies in the US say, oh, well, I don't want to take my innovation over to Europe because the health system is so different there, it won't fit in. Or vice versa, you have a lot of European companies that are like, I can't take this to the US. I don't even understand what is going on over there. Do you think that's accurate? Or do you think that you can take a solution and bring it back and forth?
Yeah. So I think anything that hits local regulatory requirements is going to be tough, right? Because you have to sort of meet requirements that are very specific for certain countries, and some are stricter than others, or just very different, or it's just a stakeholder landscape is very different. Also, the sort of relation. Private health insurance, government insurance, and the roles of these players are very different in countries. So I think that's quite tough, but can be done. But I think mostly when we look at companies that are super global and broad, it's usually solutions that are very consumer focused. So kind of leaving out some of that complexity of local healthcare systems. And others that are sort of more in the R&D field, so it's not so much sort of the commercialization, market access part, but really about research and development, like things like in clinical trials or advancing research, through simulation approaches. So, so again, these two, consumer-focused and research-focused, I think have a sort of easier job scaling than, of course, some that need to meet certain strict local requirements.
Sure. Yeah. As far as the big American tech companies getting much more involved in healthcare, we're seeing, especially this year, Apple and Amazon, even Uber to a degree, getting involved in healthcare much more than they have been. What's the sentiment over here about that? I mean, in the States, it's like all anybody is talking about, but I'm trying to get a beat on that over here, but I'm curious about your perspective because you are based in Europe. So are people excited about this, not talking about it? What's the sentiment?
No, especially in the healthcare industry, there's a lot of talk about that, right? It's sort of like, are big tech players going to disrupt healthcare completely? Are pharma companies just going to become pill producers? What's going to happen? And really what, we see is sort of like both parties kind of merging more towards each other. So like the tech players moving into healthcare, pharma industry also experimenting and also dabbling in tech. So it's really, really exciting time right now. And for me, really the answer is collaboration. I really think, both have their expertise in key areas. It's going to be a hurdle for a tech player to really understand complex landscape, especially in the pharma industry. The pharma players, are not primarily tech developers, but can learn from big tech giants. So I think really the answer is collaboration for me at the end of the day, but we'll see what the verdict is going to be. It's an exciting time.
It is. Zsuzsanna, thank you so much for joining us and sharing your perspective. It is so good to hear from like a global health innovation, just genius like yourself. I love it. Awesome. Global genius. I love it. Thank you so much for joining me. This is Jessica DaMassa with Zsuzsanna Varga from Bayer G4A. Thanks for joining us on WTF Health.
Thank you.